Comorbidity is associated with degrading health, higher complexity clinical management, and higher health care costs. The comorbidity between psychiatric disorders and type 2 diabetes has been proven, and this implied the importance to examine its underlying mechanism. Moreover, the familial aggregation of type 2 diabetes and common psychiatric disorders also suggested an influence of shared environmental factors or genetic background. Further studies showed that the association was mainly due to genetic background, especially in female. Based on a cohort of 105,184 participants, this study disclosed the underlying mechanisms of the comorbidity between psychiatric disorders and type 2 diabetes. A family history of type 2 diabetes was associated with family history of all three common psychiatric disorders, for example, schizophrenia, SCZ, major depressive disorder, MDD, and bipolar disorder, BPD. Compared to paternal type 2 diabetes, maternal type 2 diabetes demonstrated a higher strength of association with SCZ family history, indicating that women demonstrate a more predominant effective family history of type 2 diabetes on SCZ than men. Higher genetic loading for SCZ was associated with a lower risk of type 2 diabetes in women but not in men. This suggests that gender could potentially alter the genetic effect on human diseases. On the other hand, higher genetic loading for MDD was associated with a higher risk of type 2 diabetes. The output provides crucial insights indicating the need for therapies and preventive plans to address the initial development of type 2 diabetes and its comorbidity with psychiatric disorders. By understanding the underlying mechanisms of the comorbidity, high-efficacy therapeutic strategies can possibly be planned and implemented. UNSDG 3. Good health and well-being.